Lakshmi sits down to read the newspaper and reads the headline. Is the year is 2005. Lakshmi sits down to read the newspaper and reads a headline. The Protection of Women from Domestic Violence Bill has been passed and will soon be an act. She reads the article, and this tells her that domestic violence includes acts of physical, sexual, verbal, and economic violence, and that the act will apply to all women in all parts of India, irrespective of marital status and religion. Lakshmi's husband Vinod told her after marriage that she would not need to work outside the house as he made enough money for both of them and that she did not have to shoulder the financial burden. But Lakshmi wanted to put her education to use, so she asked Vinod one day if she could apply for a job. Vinod got angry and slapped her across the face. So now, as Lakshmi is reading the newspaper, she is beginning to understand that there is a name for what she has been through. She understands that she has been a victim of domestic violence. Domestic violence is a broad topic with many layers, but a basic definition would be that it refers to harm caused to the safety, life, health, and well-being of a person. This can be physical violence, which includes hitting and other bodily harm. The case of Vinod slapping Lakshmi happened only once in the course of their 5-year marriage. But the frequency of the act does not come into consideration here, so even this one instance does count as domestic violence. Sexual assault is also a form of domestic violence. Although marital rape is not recognized as a crime in India, a husband forcing his wife to engage in sex can be considered an act of cruelty. Domestic violence can also be psychological, which can be an insult communicated verbally or controlling every aspect of a person's life. Reading this, Lakshmi is reminded of her friend Anu, whose in-laws call her names because she has not had children despite being married for 3 years. She thinks about sharing the news about the Domestic Violence Act with Anu. Another form of domestic violence is economic, such as monitoring a person's access to money and keeping them financially dependent. This form of violence is also applicable to Lakshmi, as Vinod is willfully stopping her from having her own income, by which she must depend on him for money. Apart from married women, this act is applicable to unmarried women staying with the family they were born into or adopted by, and also to unmarried women in live-in relationships with men. Through the enactment of Section 498A of the Indian Penal Code, violence against married women has been a crime in India since 1983. But the 2005 Act is a watershed moment in Indian law as it outlines the creation of a support system for all women who have faced domestic violence. An aggrieved woman can contact a list of people or organizations that can help her come out of her situation. We'll get to that in a moment. In addition to this, the Act also gives a woman the right to order of protection against her husband and family. This means that a woman who files a complaint against a member of her marital home has a right to continue living in that house and cannot be thrown out after she files a complaint. The Act does not require a survivor of domestic violence to file a complaint herself. It can also be filed by a witness of the violence or a well-wisher on the survivor or victim's behalf. Lakshmi cannot file a case against Vinod for domestic violence after she has read the news, as the law does not apply in retrospect. But she has decided that she will seek outside help if Vinod shows violence again. So, what would her options be? The first resort would be to file a police complaint. According to the law, the police should treat a domestic violence survivor with sensitivity. The investigating officer then decides if the complainant needs to provide a statement or be spoken to further. The second option is to hire a lawyer who can initiate a court case or help with the right information about the legal options available. The courts have, in the past, risen to the defense of aggrieved women. In a 2019 case, the Supreme Court said that a complaint of domestic violence may be filed against a husband or male partner or against his relatives depending on the situation. This is important as it gives an unmarried woman in a live-in relationship with a man the same rights as a married woman. The same year, the Calcutta High Court directed a man to award a compensation of 1 lakh rupees to his wife on account of the mental agony caused to her by his conduct. Though the complainant got the court to award a compensation in this case, the court said that the grant of compensation cannot be justified in the absence of evidence. The burden of proof is a big issue in cases of domestic violence. In the absence of it, the courts may not always be in the woman's favor. In a 2019 judgment, the Supreme Court said that a mere allegation of domestic violence is not enough to bring a case under the purview of the Domestic Violence Act. In 2018, the conviction rate for domestic violence cases under Section 498A was only 13%, compared to the 50% conviction rate for all IPC cases that year. If going to the police or court is too intimidating or expensive, a survivor can approach non-governmental avenues like NGOs or women's helplines for guidance. These avenues offer support to survivors by helping them with legal information and offering counseling. These are some of the resource centers for domestic violence survivors in India. In 2015, the Ministry of Women and Child Development launched Swadhar Grah for women in distress. The scheme aims to provide shelter, clothing, food, counseling, training, and legal aid to women in distress. The list of beneficiaries includes survivors of domestic violence. As of 31st December 2020, 362 shelters were operational. The list of these is in the description. But only 43.7% of the total fund allotted to the scheme was utilized in the 3 financial years from 2017 to 2020. Despite all the systems in place for women to seek help, the fact is that there are many obstacles a domestic violence survivor will have to overcome, the main one being the reactions of the people around her. The medical system often refuses to see domestic violence as a health issue and does not screen patients for violence. And the police and the victim's loved ones often either don't take her complaint seriously or blame her for not speaking up until it's too late. On the large scale, the government should ensure strict implementation of the law on the ground so that women who come forward to complain feel safe in doing so. They should have the confidence that their complaint will be taken seriously and that they have a safe place to stay in after doing so. At the individual level, each of us should educate ourselves on the issue and share the right information with people we think may need it. The year is 2005. Lakshmi sits down to read the newspaper and reads a headline. The Protection of Women from Domestic Violence Bill has been passed and will soon be an act. She reads the article, and this tells her that domestic violence includes acts of physical, sexual, verbal, and economic violence, and that the act will apply to all women in all parts of India, irrespective of marital status and religion. Lakshmi's husband Vinod told her after marriage that she would not need to work outside the house as he made enough money for both of them and that she did not have to shoulder the financial burden. But Lakshmi wanted to put her education to use, so she asked Vinod one day if she could apply for a job. Vinod got angry and slapped her across the face. So now, as Lakshmi is reading the newspaper, she is beginning to understand that there is a name for what she has been through. She understands that she has been a victim of domestic violence. Domestic violence is a broad topic with many layers. But a basic definition would be that it refers to harm caused to the safety, life, health, and well-being of a person. This can be physical violence, which includes hitting and other bodily harm. The case of Vinod slapping Lakshmi happened only once in the course of their 5-year marriage. But the frequency of the act does not come into consideration here, so even this one instance does count as domestic violence. Sexual assault is also a form of domestic violence. Although marital rape is not recognized as a crime in India, a husband forcing his wife to engage in sex can be considered an act of cruelty. Domestic violence can also be psychological. which can be an insult communicated verbally or controlling every aspect of a person's life. Reading this, Lakshmi is reminded of her friend Anu, whose in laws call her names because she has not had children despite being married for 3 years. She thinks about sharing the news about the Domestic Violence Act with Anu. Another form of domestic violence is economic, such as monitoring a person's access to money and keeping them financially dependent. This form of violence is also applicable to Lakshmi, as Vinod is willfully stopping her from having her own income, by which she must depend on him for money. Apart from married women, this act is applicable to unmarried women staying with the family they were born into or adopted by, and also to unmarried women in live-in relationships with men. Through the enactment of Section 498A of the Indian Penal Code, violence against married women has been a crime in India since 1983. But the 2005 Act is a watershed moment in Indian law, as it outlines the creation of a support system for all women who have faced domestic violence. An aggrieved woman can contact a list of people or organizations that can help her come out of her situation. We'll get to that in a moment. In addition to this, the Act also gives a woman the right to order of protection against her husband and family. This means that a woman who files a complaint against a member of her marital home has a right to continue living in that house and cannot be thrown out after she files a complaint. The Act does not require a survivor of domestic violence to file a complaint herself. It can also be filed by a witness of the violence or a well-wisher on the survivor or victim's behalf. Lakshmi cannot file a case against Vinod for domestic violence after she has read the news, as the law does not apply in retrospect. But she has decided that she will seek outside help if Vinod shows violence. file a police complaint. According to the law, the police should treat a domestic violence survivor with sensitivity. The investigating officer then decides if the complainant needs to provide a statement or be spoken to further. The second option is to hire a lawyer who can initiate a court case or help with the right information about the legal options available. The courts have, in the past, risen to the defense of aggrieved women. In a 2019 case, the Supreme Court said that a complaint of domestic violence may be filed against a husband or male partner or against his relatives depending on the situation. This is important as it gives an unmarried woman in a live-in relationship with a man the same rights as a married woman. The same year, the Calcutta High Court directed a man to award a compensation of 1 lakh rupees to his wife on account of the mental agony caused to her by his conduct. Though the complainant got the court to award a compensation in this case, the court said that the grant of compensation cannot be justified in the absence of evidence. The burden of proof is a big issue in cases of domestic violence. In the absence of it, the courts may not always be in the woman's favor. In a 2019 judgment, the Supreme Court said that a mere allegation of domestic violence is not enough to bring a case under the purview of the Domestic Violence Act. In 2018, the conviction rate for domestic violence cases under Section 498A was only 13% compared to the 50% conviction rate for all IPC cases that year. If going to the police or court is too intimidating or expensive, a survivor can approach non-governmental avenues like NGOs or women's helplines for guidance. These avenues offer support to survivors by helping them with legal information and offering counseling. These are some of the resource centers for domestic violence survivors in India. In 2015, the Ministry of Women and Child Development launched Swadhar Grah for women in distress. The scheme aims to provide shelter, clothing, food, counseling, training, and legal aid to women in distress. The list of beneficiaries includes survivors of domestic violence. As of 31st December 2020, 362 shelters were operational. The list of these is in the description. But only 43.7% of the total fund allotted to the scheme was utilized in the 3 financial years from 2017 to 2020. Despite all the systems in place for women to seek help, the fact is that there are many obstacles a domestic violence survivor will have to overcome, the main one being the reactions of the people around her. The medical system often refuses to see domestic violence as a health issue and does not screen patients for violence. And the police and the victim's loved ones often either don't take her complaint seriously or blame her for not speaking up until it's too late. On the large scale, the government should ensure strict implementation of the law on the ground so that women who come forward to complain feel safe in doing so. They should have the confidence that their complaint will be taken seriously and that they have a safe place to stay in after doing so. At the individual level, each of us should educate ourselves on the issue and share the right information with people we think may need it. The year is 2005. Lakshmi sits down to read the newspaper and reads a headline. The Protection of Women from Domestic Violence Bill has been passed and will soon be an act. She reads the article, and this tells her that domestic violence includes acts of physical, sexual, verbal, and economic violence, and that the act will apply to all women in all parts of India, irrespective of marital status and religion. Lakshmi's husband Vinod told her after marriage that she would not need to work outside the house as he made enough money for both of them and that she did not have to shoulder the financial burden. But Lakshmi wanted to put her education to use, so she asked Vinod one day if she could apply for a job. Vinod got angry and slapped her across the face. So now, as Lakshmi is reading the newspaper, she is beginning to understand that there is a name for what she has been through. She understands that she has been a victim of domestic violence. Domestic violence is a broad topic with many layers, but a basic definition would be that it refers to harm caused to the safety, life, health, and well-being of a person. This can be physical violence, which includes hitting and other bodily harm. The case of Vinod slapping Lakshmi happened only once in the course of their 5-year marriage. But the frequency of the act does not come into consideration here, so even this one instance does count as domestic violence. Sexual assault is also a form of domestic violence. Although marital rape is not recognized as a crime in India, a husband forcing his wife to engage in sex can be considered an act of cruelty. Domestic violence can also be psychological, which can be an insult communicated verbally or controlling every aspect of a person's life. Reading this, Lakshmi is reminded of her friend Anu, whose in-laws call her names because she has not had children despite being married for 3 years. She thinks about sharing the news about the Domestic Violence Act with Anu. Another form of domestic violence is economic, such as monitoring a person's access to money and keeping them financially dependent. This form of violence is also applicable to Lakshmi, as Vinod is willfully stopping her from having her own income, by which she must depend on him for money. Apart from married women, this act is applicable to unmarried women staying with the family they were born into or adopted by, and also to unmarried women in live-in relationships with men. Through the enactment of Section 498A of the Indian Penal Code, violence against married women has been a crime in India since 1983. But the 2005 Act is a watershed moment in Indian law, as it outlines the creation of a support system for all women who have faced domestic violence. An aggrieved woman can contact a list of people or organizations that can help her come out of her situation. We'll get to that in a moment. In addition to this, the Act also gives a woman the right to order of protection against her husband and family. This means that a woman who files a complaint against a member of her marital home has a right to continue living in that house and cannot be thrown out after she files a complaint. The Act does not require a survivor of domestic violence to file a complaint herself. It can also be filed by a witness of the violence or a well-wisher on the survivor or victim's behalf. Lakshmi cannot file a case against Vinod for domestic violence after she has read the news, as the law does not apply in retrospect. But she has decided that she will seek outside help if Vinod shows violence again. So, what would her options be? The first resort would be to file a police complaint. According to the law, the police should treat a domestic violence survivor with sensitivity. The investigating officer then decides if the complainant needs to provide a statement or be spoken to further. The second option is to hire a lawyer who can initiate a court case or help with the right information about the legal options available. The courts have, in the past, risen to the defense of aggrieved women. In a 2019 case, the Supreme Court said that a complaint of domestic violence may be filed against a husband or male partner or against his relatives depending on the situation. This is important as it gives an unmarried woman in a live-in relationship with a man the same rights as a married woman. The same year, the Calcutta High Court directed a man to award a compensation of 1 lakh rupees to his wife on account of the mental agony caused to her by his conduct. Though the complainant got the court to award a compensation in this case, the court said that the grant of compensation cannot be justified in the absence of evidence. The burden of proof is a big issue in cases of domestic violence. In the absence of it, the courts may not always be in the woman's favor. In a 2019 judgment, the Supreme Court said that a mere allegation of domestic violence is not enough to bring a case under the purview of the Domestic Violence Act. In 2018, the conviction rate for domestic violence cases under Section 498A was only 13%, compared to the 50% conviction rate for all IPC cases that year. If going to the police or court is too intimidating or expensive, a survivor can approach non-governmental avenues like NGOs or women's helplines for guidance. These avenues offer support to survivors by helping them with legal information and offering counseling. These are some of the resource centers for domestic violence survivors in India. In 2015, the Ministry of Women and Child Development launched Swadhar Grah for women in distress. The scheme aims to provide shelter, clothing, food, counseling, training, and legal aid to women in distress. The list of beneficiaries includes survivors of domestic violence. As of 31st December 2020, 362 shelters were operational. The list of these is in the description. But only 43.7% of the total fund allotted to the scheme was utilized in the 3 financial years from 2017 to 2020. Despite all the systems in place for women to seek help, the fact is that there are many obstacles a domestic violence survivor will have to overcome, the main one being the reactions of the people around her. The medical system often refuses to see domestic violence as a health issue and does not screen patients for violence. And the police and the victim's loved ones often either don't take her complaint seriously or blame her for not speaking up until it's too late. On the large scale, the government should ensure strict implementation of the law on the ground so that women who come forward to complain feel safe in doing so. They should have the confidence that their complaint will be taken seriously and that they have a safe place to stay in after doing so. At the individual level, each of us should educate ourselves on the issue and share the right information with people we think may need it. The year is 2005. Lakshmi sits down to read the newspaper and reads a headline. The Protection of Women from Domestic Violence Bill has been passed and will soon be an act. She reads the article, and this tells her that domestic violence includes acts of physical, sexual, verbal, and economic violence, and that the act will apply to all women in all parts of India, irrespective of marital status and religion. Lakshmi's husband Vinod told her after marriage that she would not need to work outside the house as he made enough money for both of them and that she did not have to shoulder the financial burden. But Lakshmi wanted to put her education to use, so she asked Vinod one day if she could apply for a job. Vinod got angry and slapped her across the face. So now, as Lakshmi is reading the newspaper, she is beginning to understand that there is a name for what she has been through. She understands that she has been a victim of domestic violence. Domestic violence is a broad topic with many layers. But a basic definition would be that it refers to harm caused to the safety, life, health, and well-being of a person. This can be physical violence, which includes hitting and other bodily harm. The case of Vinod slapping Lakshmi happened only once in the course of their 5-year marriage. But the frequency of the act does not come into consideration here, so even this one instance does count as domestic violence. Sexual assault is also a form of domestic violence. Although marital rape is not recognized as a crime in India, a husband forcing his wife
with the blessings of His Holiness Jagadguru Sri Shivaratri Deshikendra Mahaswamigalu, a very good afternoon to the dignitaries, invited guest speakers, dear colleagues, fellow students, ladies and gentlemen. I, Dr. Chanchala, on behalf of the organizing committee, take this as an immense pride to welcome each and everyone to the series of programs organized to sensitize us on elimination of violence against women, beyond barriers, respect, empower women at higher education and workplace. Today's session emphasizes on women wellness. There are 5 main aspects to personal health or wellness: physical, emotional, social, spiritual, and intellectual. In order to be considered well, it is imperative none of these areas to be neglected. To know more on the women wellness, we have a team of eminent speakers for today, and we have our chairpersons for the day's program to reflect on these sessions. I welcome Dr. Praveen Kulkarni, Associate Dean, IQAC JSS Ahead, and Vice Principal Paraclinical, Professor of Community Medicine. I heartily welcome Dr. Rajalakshmi, Professor, Department of Physiology, and Dr. Suma, Reader, Department of Orthodontics, to kindly grace the dais. Thank you. I request all the participants to please be seated. We have with us Dr. Meenakshi S. as a resource person for the first session, talking on ergonomic wellness, integrating health protection and promotion. Dr. Meenakshi S. is an assistant professor at Jesus Dental College and Hospital. She has disseminated research knowledge through scientific publications in various national and international peer-reviewed index journals. She has represented Jesus Academy of Higher Education and Research at various scientific deliberations nationally and internationally. She has completed an ergonomic course from Recop International, Bengaluru, and has attended various research workshops to upgrade, enrich, and share knowledge. She also holds a diploma in nutrition from Shaw Academy, which would facilitate nutritional guidelines rendered to geriatric patients. She has completed her PhD in the Faculty of Dentistry in the year 2020 and received a DBT research grant for her PhD thesis, Development and Evaluation of Polyherbal Formulation for Antifungal Activity in Geriatric Denture Wearers, and completed one ICMR-funded research project. She also has to her credit ICMR-approved project, Postural Evaluation and Development of an Ergonomic Paradigm for Dental Professionals, a longitudinal cohort study. She has been the pioneer to initiate the value-added certificate program to combine cognitive dental ergonomics to UG and PG students of Jesus Dental College. She has to her credit 2 patents published. With this brief introduction, we are waiting to learn more from you, Dr. Meenakshi. Over to you.
Good afternoon, everybody. Good afternoon, chairpersons. Thank you so much, Dr. Chanchala, for that brief introduction of mine. And research is something which is a long way to go, and I am in that journey. So before the presentation of my topic per se, there's a small question which is put up on the slide, and I want sincere answer for this. How many of you have encountered pain in their neck, back, shoulders, wrist, and elbow? Let me be honest. With myself raising my hand. Thank you so much, sir. Thank you so much, ma'am. Thank you. That's quite a lot of a number. So that means I take the answer as yes. So if the answer is yes, how many of you have resorted for medications just to alleviate the pain? Sir? Yes? Medications? Okay. Who has been actively involved in a little bit of physical activity, I think most of us, and there are quite a lot of them who are intermittent, not consistent. Yes, intermittent and consistent. Who are consistent? Good. Who are intermittent? A little larger number. So intermittent is larger number when compared to consistency. So this is a small questionnaire survey which we did in 2018. And me being a prosthodontist, a dental healthcare professional, we have applied this concept to know how many of our dental practitioners, including students and educators, who are commonly involved in such pain-related pathologies, which is often termed as work-related musculoskeletal disorders. And to our surprise, we got around 73% or 69% not engaged in any kind of physical activities, around 78% of them often requiring medical assistance to alleviate their pain. And when we got to know how many of them are having neck and shoulder pain, it was surprising to note around 50% of them were actually suffering from neck, shoulder, and back pain. And this was in 2020, during the era of COVID-19 pandemic. We administered a small questionnaire survey just to know among the postgraduate students to know whether they are also equally involved in anticipating or having that kind of pain. And to our surprise, we also had the surprise that they are also equally exposed to such kind of work-related musculoskeletal disorders. So if you could see this slide, you can actually see that with the advent of COVID-19 pandemic since 2 years, we are in the new normal, right? digitalization has taken its way and it is in the peak, and all of us are actually exposed to a lot kind of computer-based activities, laptop-based activities, institutional-based activities, be it a healthcare professional or a clerk working in the office or a maintenance staff, be it anybody. I think most of us are commonly exposed to laptop-based or monitor-based working system because of the new normal. And we are all taking our own pace to get adjusted to this new normalcy. So what do we actually see here? This is a healthcare professional delivering a quality treatment to his or her patient. So the major disadvantage of this kind of treatment being rendered by healthcare professional is large amount of bending and gaining access to a smaller, narrow stomatognathic system, especially in our fraternity, dental fraternity. We are the smaller oral cavity where we need to gain access to give the quality kind of treatment. To gain that, we do have mental stress. Of course, Dr. Kishore sir is here to enrich more on that and how to elevate the mental stress. There are large amount of visual challenges actually we come across. We are into repetitive motions. If we are using a laptop-based working condition or a monitor-based working condition, we are still subjected to repetitive motion. At the same time, we are in that constant position for a longer duration without having any change in the posture and repetitive force. Yes. So to highlight on this, I'm here to share a little bit of knowledge which I have gained over a period of time on what is called as ergonomic wellness, integrating health protection and promotion. So before the start of the topic per se, I definitely would like to thank the organizing committee for giving me this opportunity to highlight on this very important topic. So my topic will be covered on this under these headings. What is this concept? What is this ergonomics about? What is work-related musculoskeletal disorders? What are the signs and symptoms of these WMSD? What are the risk factors associated? And today I'm narrowing it down only on computer workstation design and work practices to reduce such risk factors, thus helping health protection and promotion. So this would be an interactive training, I hope so. And post lunch, of course, interaction would be a little difficult, but I would like to have a little bit of interaction among you people. And the information will be shared under these important headings. General information will be subjected as to your right hand corner of the slide will be the information which you are supposed to know. And there are certain basic instructions which you are supposed to do during your execution of your work. And there are certain supplementary information to know why are you doing it. So coming to the topic per se. So the stability of a person is mainly maintained by these vertebrae. I think all of us agree. And most of us actually know that there are intervertebral discs which mainly helps us to keep ourselves stable, whether we are sitting or we are standing. And this stability is mainly achieved by these two curves. There are two curves which is called as primary curves and secondary curves, which mainly helps to maintain our body stable. So there are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral and 1 coccyx vertebrae, thus helping to stabilize the muscles along with the vertebrae. So to narrowing it down, this is how it looks like, what the different muscles the vertebrae actually support. So having these vertebrae in that normal cervical condition or those curvature helps to maintain the patency between the vertebrae, which could help the blood supply, nerve supply, thus helping the rich supply of oxygen and helping us to perform the required day-to-day tasks. So these vertebral spaces helps, or the curvature helps to maintain these patency between the vertebrae and thus helping us to maintain what is called as neutral posture. Now what we are sitting is neutral. What right now you're sitting is neutral. Let's see over a period of time during my sessions, you will get to know whether your seating arrangement here is neutral or not. Okay. So this is your standing and sitting neutral posture. So this is the curvature in relation to your chair, what you're sitting right now, maintaining the spinal curvatures in relation to the chair, whatever you are supposed to maintain. Okay. These are the cervical lordosis or kyphosis, which helps to maintain the curvature of the spine. Now, supposing you're going to slouch. Are you sitting right like this or are you slouching right now? If I see from here, most of you are slouching. I'll tell you why in my subsequent slides. So because we are sitting here for quite a long duration, we are always under static motion. It is not dynamic. It is actually leads to large amount of muscle fatigue. When there is muscle fatigue, there is more accumulation of lactic acid until unless there is rich oxygen supply. Now, rich oxygen supply is hampered right now because your posture is not curved but slouched. Because there is large amount of lactic acid accumulation, there is increased amount of pain. resulting in large amount of contraction of these muscles, which I mentioned earlier, resulting in joint hypermobility. There is no mobility of the joints, thus leading to compromised work efficiency. So apart from maintaining those curves, you end up with large amount of flexion. Now all your spine is straight. Do you agree with me? Is the curvature maintained in your position right now? Anybody from the audience, please? If it is interactive, it is better. So this curvature is not maintained right now. Now your spine is straight. The curvature is lost. So let's get into still more details. How heavy is our head? Any answers for this? My head is around 12 kgs. Or sorry, 12 pounds, which sums up to 4.5 kgs in relation to the spine. So because of the curvature of the spine, I'm able to bear the weight of the head. So every time I am getting myself forward, when do I get myself forward? Whenever I'm slouching, I am getting my head forward. So whenever I am getting my head forward, I'm increasing the load on the spine by around 10 pounds. So 42 pounds of head by every 3 inches forward will come up to 19 kgs of load being subjected on the spine. Okay, 19 kgs against the normal 4.5 kgs where the spine can bear. Okay, you are subjecting it to 19 kgs of load. The new normal, all of us do agree with this. The new normal, even now, if you give a pause of 2 or 3 minutes, you'll start texting. Yes, it's so boring. I think it's better to wind up faster, and you'll start texting your friends, your colleagues. You know, the texting itself will lead to large amount of force on the spine. So ultimately, you will end up with what is called as work-related musculoskeletal disorders targeting all these areas: neck, cervical spondylosis, your trapezius muscles, myalgia, low back pain, carpal tunnel syndrome. I'll be explaining what it is, and what is called as wrist drop. Apart from this, the curvature of spine being not maintained and slouched position can also have effect on the temporomandibular joint. Your occlusion could also get affected. There are research which has been taken over a period of time, but there are no valid data to support on it. But definitely because of slouching, there is some amount of wear and tear happening even in relation to your temporomandibular joint. So now coming to the topic per se, laptop and computer based, again, those people are also subjected to what is called as work-related musculoskeletal disorder. Now, what is this terminology? So work-related musculoskeletal disorder has been defined by World Health Organization as the disorders of muscles, tendons, peripheral nerves, and vascular system, not directly resulting from an acute trauma. That has to be underlined. I would like to grab your attention there. Not resulting from an acute trauma or an instantaneous event. So what could be the causes of this? Do you agree with me? Awkward or static postures, keeping it for a longer duration. Even after knowing that you're not sitting straight, you're still continuing to rest or slouch in the same position. High hand forces, typing for longer duration, highly repetitive motions, your keypad or your keyboard or your mouse not in the correct position, and large amount of contact stress. I'll tell you what that is. So this is your awkward or sustained posture for a longer duration to submit your thesis or your project or your research publication or typing or whatever. Even in the office premises, lot of things happening. I think sir would be better to explain right now. So extended forward posture, you can actually see even in the office scenario, or even if you're a healthcare professional, I'm working and I'm getting back to the new normal condition where I'll have to sit and work continuously because I have to submit 2 publications. So bending forward and waiting, and during setting, I am slouching and my shoulders are shrugged. Because I'm slouching, I am getting my shoulders are also forward. Repetition with my mouse, not able to judge what is the right kind of mouse I'm selecting. Is the mouse selected right? And I'm using the mouse, not knowing how to use the mouse. So in a healthcare setup, especially in a dental fraternity, this is what we commonly encounter. And that's why we have initiated a certificate program on dental ergonomics. So we are constantly involved in repetitive motion, narrow stomatic dental system, large amount of forces being activated, and constant slouched posture. So these are the risk factors ultimately leading to work-related musculoskeletal disorders. I would like to draw your attention on these 2 important things. A little facts and figures here. Bending or twisting your back in an awkward way. This was a study done in 2014, published in Indian Journal of Occupational and Environmental Medicine. Around 20% are mostly subjected to this. Still more shocking is continuing to work while the injury has happened, and you still continue to work with sustaining that injury for a longer duration. You take medication and you start working. And If you see the statistics of the work-related musculoskeletal disorders, we top the list. The healthcare professionals top the list where we are commonly exposed to such conditions. So why is it important to act early? Now we are normal. You people think you're sitting right and working right and looking at the slides, it is normal. But you will have a little bit of discomfort. You are actually changing your position quite often. So that denotes that there is some discomfort in the chair provided to you. If not treated at that stage, if you're not recovering or resting, it leads to pain. So every time I'm telling this, kindly get back to your scenario and try to reapply this phenomena, whether it was normal. If there was discomfort, did you do anything for the discomfort? If not treated, was there any pain? Now, when there was pain, did you treat? If not, there was injury. Even after happening, even after the injury being occurred, have you interacted for that injury? Now, what I would like you to concentrate is the activity could be non-work related, again leading to injury, or work related. Now, this was a study to know the classification of occupational injuries. And it would be shocking and surprising for us to see the statistics around 46% were injuries or work-related injuries made worse because of what? Because of our own induced work. 46% of us are suffering because of injuries made worse due to work. So today is the era, or this December itself, or the whole week is women empowerment, and I've got this opportunity to deliver this lecture to you. So I would like to ask some questions. So some questions also arise in relation to women, health and repetitive work. Are we subjected to repetitive work when compared to men? What are the conditions of work, the health of women workers, and the productivity? Of course, WHO has already told that if women is there in the institution, the productivity is more. The recent article, I've forgotten to put that article actually, but then it has actually told that the more the women in the institution, the better is the productivity of that institution. Now, to our surprise, most of the women working in the institution are subjected to such kind of disorders, more of back pain, muscle pain, overall fatigue, repetitive. So repetitiveness is one thing which we women are most often subjected to. And when we compare a working day of men over women, men work 7 hours, 47 minutes, paid work. You can actually see the statistics there. And when you compare with women, around 4 hours, 47 minutes is unpaid. Unpaid work and still stressed. That has to be underlined. And this was published in one of the indexed books of Intake Open, where women, ergonomics and repetitiveness was showcased. So what is this buzzword which is ergonomy? Ergonomy. So is this ergonomy without having any pain to lift the child up? Yes, that is ergonomics. Ergonomics is nothing but fitting the job to cater to your needs and not the vice versa. Now you people are sitting, the chair is not comfortable, but still you're sitting. So this is not ergonomics. So you make the chair comfortable for you so that you can deliver quality work. So that is ergonomics. Ergonomics is split into ergo means work, nomos is natural laws. It was first coined by Hyven Murrell in 1959. So there are many ways people position themselves in relation to monitors and laptops. So let's learn the ideal way. So there are 4 areas you are supposed to focus. Today we are narrowing it down only on monitors and laptops. So these are the 4 areas which I will be talking in relation to chair positioning, hand to mouse and keyboard, feet to floor, and eyes to the screen level. My screen level is not right today. Okay, coming to body or the positioning of your chair. Some of the discomforts which you commonly see in laptop or computer usages are all these. Tension neck syndrome. I can actually see so many people doing text neck syndrome. This is called as text neck syndrome without knowing that they are also subjected to such kind of trauma or disorder in near future. There's something called as de-Querien syndrome. Just below your thumb, you will have pain here. Okay, most of us would have had this but neglected. Low back pain and something called as carpal tunnel syndrome because of improper usage of mouse and keyboard. The keyboard tray not positioned accurately and you end up with pressure. Plethora of executive chairs. I think most of us have seen such kind of chairs. Even at our institution or in the office premises, you see large amount of chairs. So one size fits all concept is being used everywhere. Whether it is a male or a female, we have one chair which is provided. So is that chair comfortable for me? Is that chair comfortable for him? Nobody knows. So the first important rule or the golden rule or the rule of thumb to follow is how to adjust your chair. So that's very important. When you sit yourself back and you have one fist distance between your calf muscles and the edge of your chair, that denotes you have selected the right kind of chair. If not, you need to adjust the chair. Now, how do I adjust? If this is chair height being too high, chair height being too low, and this is appropriate. It has to form a right angle with the seat pan. If it is not, you end up with what is called as contact stress. Now, if your chair is not adjusted properly, you will have contact stress near your carpal tunnel where the median nerve gets compressed here and you end up with pain. If that is the case in relation to your wrist, you also have pain in relation to your calf muscles. So what are the adjustments you're supposed to know? You're supposed to adjust your seat pan depth and height, your seat pan angle, and the positioning or the backrest of your seat. So what makes a chair ergonomic is how well you suit yourself. If you feel that you are fitting for that chair, then it is appropriate. Otherwise, kindly try adjusting your chair. So these are the areas you're supposed to adjust. Don't adjust yourself, try to adjust the chair. That's what I want to convey. So this is your chair adjustment sequence. Try to follow the curvature of your spine. If it is not, now in all your chairs which is provided right now, your spine is almost straight, it is not curved. Now we cannot complain about the organization. They are doing a lot for us, but we can reposition ourselves by giving certain cushioning behind so that the lumbar curvature is maintained, right? You can have some cushions which is placed here just below in relation to lumbar curvature. If the chair height is not sufficient, place a cushion so that it raises, provided your feet is flat on the floor. Now, once the chair is adjusted, you're supposed to adjust your armrest which is given in your executive chairs. Now, the armrest which most of us end up having is this, at the same height, slightly lower or slightly higher. So try to adjust your armrest in such a position that your armrest is almost neutral. Now, how do I know that my armrest is accurate? When my body positions or my body parts are closer to my body, that denotes that my armrest is at the right position. If it is abducted, that means you need to position your armrest in such a way that they are closer to you. Yes. So if using a keyboard tray, lower the height of the keyboard tray to level with the armrest. If not, try to raise the chair. Once you raise the chair, your feet will not be flat on the floor, right? Agree? Your feet will not be flat on the floor. Now, how do I get the feet flat on the floor? I am a short-statured healthcare professional. My feet is not getting closer to the floor. I keep a small table there so that my feet can be rested on that. It should not be hanging over. So this is how you're supposed to rest your arm in relation to your keyboard. If using a keyboard tray or if not using a keyboard tray. If using a keyboard tray, try to raise the keyboard tray a little high so that it comes in the neutral position, a neutral wrist position. If not using, try to raise the chair. Next, coming to feet flat on the floor. If the feet is not flat on the floor, I think most of us end up, I can see one girl sitting like that. Yes. So the moment that feet is just back, you are slouching forward because you need to gain access, right? The moment the feet is flat or going behind the chair, you will come forward to reach whatever you want to reach, right? So that has to be avoided and you can use foot rests. So this is what happens. The moment the feet is flat or the feet is backwardly placed, you come forward to reach the area of your interest. So that has to be avoided by having foot rests. And to mouse and the keyboard, it has to be neutral position. The major thing which you're supposed to think, the golden rule to follow is we should not have any ulnar deviation, not deviating like this. It should be flat on the floor. Your movement should be just this, right? You can actually see the keyboard and mouse should be located on the same level and the elbows should be just 90 degrees and not being abducted. So how can I do that? You can actually use wrists to be flat and we should avoid angled wrists. This movements has to be avoided. How can I do that? You can do what is called as use a wrist rest. Now wrist rest should be used in such a way you don't compress here. This contact stress should be avoided and there should be ample space for your median nerve there. No compression, right? So you can use either an armrest or a mouse platform so that your arm is almost flat and there is no wrist twist or ulnar deviation. Ergonomic keyboards, lot of keyboards are available. We don't know what to select. Now I am a left-handed dentist. I would like to have my number plates on that side so that it will be easy for me. So there are plethora of keyboards are also available. So suit yourself and try to utilize the kind of keyboards which suits you. The only advantage or thumb rule you're supposed to follow is don't have to have ulnar deviation. Additional keyboard tray considerations, a motion type of keyboards, mechanical, movable, you can use, or fully adjustable keyboard tray can also be attached to your workstation, or independent mouse, a keyboard tray along with the mouse can also be considered. So this is the additional keyboard consideration, has to be angulated, 90-degree angulation, apart from having bent angles. Right? So this is what you're supposed to have, no abduction and all arms closer to your body. So design your workstation in such a way that all the body parts are closer to the center of gravity. Ergonomic mouse, plethora of ergonomic mouse are also available. Right? I think all of us are having to know this vertical mouse and the, I think most of us are aware of all this. So only thing which you're supposed to avoid is pinch grip of the mouse when you're using. Eye to screen, my eye distance to my screen is not appropriate. I should have had something high, right? So how do I check different kind of monitors? And we are provided with monitors even in the institution, in the office premises and everything. So we need to adjust ourselves to our workstation to cater the needs. Don't adjust yourself to the screen. Try to raise it in such a way that when a horizontal line is drawn between the eyes, that distance or that line should coincide with the top of your laptop or your monitor, right? So this is how it should be. A chin tuck, too much of tucking, which results in lowering or neck bending, should be avoided. Okay. So dual monitors, if you're using, try to division the area of interest, whichever you are concentrating on, and try to position both the monitors. Single Mac computer, try to raise it so that it is at the level. So what is the rule of thumb to follow? An arm distance between the top of the monitor to your eye. So that is the rule of thumb which you're supposed to take in. Now, why this has to be done? To prevent twisting and turning, right? So when you're using laptops, I think most of us are aware, immediate presentation, ethical committee clearance. I think most of us will be sitting outside and preparing our slides. We almost end up doing all this. So let's be more proactive. Let us prepare beforehand and come so that we don't avoid all these hassles. So common monitor height mistakes. If at all, if you're using a bifocal lens, specs, what should be the positioning? Most of us end up seeing like that because they have bifocal lens. So what is the rule of thumb to follow? If at all, if you're using a specs which is bifocal, place it a little down so that you'll be able to visualize. So how do I get to know that I'm visualizing it correctly? Your eyeball should rotate only 15 degrees down, not more than that. So 15 to 20 degrees is the maximum deviation acceptable. So if at all, if you're using a laptop, try to use a laptop extension so that you are positioning yourself in relation to your eyes. So eye level. If the height of the table is too high, try to raise the chair. And if your feet is not flat, try to use a floor rest. It is very important for us to deviate or transit or having a paradigm shift between sit and stand workstations. You cannot sit for more than an hour in one particular position. So after my presentation, kindly stand for 2 seconds and then sit before Kishore sir starts his presentation, right? A sincere request to all the audience, including the chairpersons as well. So there is workstation movement where you can manually, there are availabilities where you can change the sitting into standing by maneuvering it and raising the table and try to maintain the same workstations. So this is your sitting and standing workstations where you can change. Only thing is your monitor height should be appropriate. When you're using laptop only, laptop extension, you can have extended keyboard or a keyboard tray attached to it. Some additional considerations you're supposed to use if you're using overhead lighting, try to keep it minimal. A target lighting would be beneficial if you are late night worker. If you're using a laptop and if you're working, a target light would be beneficial. And yes, the most important thing is 20-20-20 rule. Very important. After every 20 minutes, try to stop your laptop working and try to see somewhere away, 20 feet away from it, and for 20 seconds, and then get back to your normal. So to summarize, adjust the chair to fit you. Don't do the vice versa. Assure you have adequate foot support. Very important. People who are wearing heels and everything, you're supposed to take care. Use your keyboard and mouse at the same level and avoid reaching, slouching. If you have to reach, then you'll be slouching. Position your monitors to avoid neck pain and take ergo breaks. I think now you're aware of what is ergonomics. So we should avoid this and we should work smart and work right. So no sort of exercise is so healthful or harmless that it does not cause serious disorders when overdone. Bernardino is the father of physiotherapy. He was the first person who told this. Anything can be harmful if overdone. So this was the clipping which I saw in Amazon. Provided it is helpful, it should not cause pain to your neck. So this, as a part of my dental ergonomics certificate program, we have designed this 12 chair side Surya Namaskar at operatory, which is quick 3 minutes exercise, mainly designed for dental operators or healthcare professionals. All of you can actually implement this, take rest breaks, ergo breaks in between, and try to follow this. Thank you so much. Thank you one and all for your patience here.
Indeed, a very comprehensive presentation, I must say. Dr. Meenakshi has shared the mantras on how to work smart, and now it's up to each one of you whether how you inculcate these tips into your routine. It depends on the audience, chairpersons, all of you. So as she has mentioned, I think all the audience should stand for 2 minutes except for her, because she's been standing for almost 30 minutes now. Who can be seated?
Thank you so much. Thank you. Thank you. Thank you so much.
Just stretch around a little bit. So you can wake up for Kishore sir's talk with a lot of energy. The session is now open for discussion. Any queries, please? I request even the UT team to participate if there are any queries.
This is the question I think most of them have asked me. I am a left-handed dentist, so I ended up practicing standing only, and not being able to gain access whenever I was doing in my undergraduate. And my teachers were all right-handed dentists, and they were having a lot of difficulty to teach me actually. So teaching was not that very easy, and I had to literally struggle and position myself. So then I thought, I think probably this would be a right way to teach my left-handed fraternity or my left-handed colleagues, if at all, if there are any lefties, and that gained interest in this concept, because ergonomics is one thing which is applied everywhere. But why not in dentistry then? Because we do have small equipments, maneuvers, designing, workstation. So I started working more on it, and I've attended courses which was more exclusively designed for civil engineering. There were no courses which was actually designed for dentistry per se. So then I came up with this course. So I think my students are having a little bit of benefit from them, benefit of this workshop, but probably that importance has to be gained, that we need to fit the station to our needs, but we are doing it the other way around. I think that has to be reminded quite very often, that we need to not fit ourselves to faulty designs, but design it appropriately so that we can work smart and deliver quality treatment to our patients. Thank you.
Dr. Meenakshi, I request the chairpersons to reflect on the presentation.
I thank Dr. Meenakshi for the wonderful presentation. So we all are committed to do the healthy and productive work environment. So this is what makes us like, if we don't know, we have to learn at any point of time, and we have to take some training if he doesn't know it. So this is what is done by Dr. Meenakshi, and it is a wonderful presentation. And probably the good shoes and the good chair and good working environment will give healthy and productive work. That is what we require at the end of the day. I thank Dr. Meenakshi and also the organizing committee for the opportunity. Thank you.
Thank you so much, Dr. Suma. May I request Dr. Rajalakshmi, the chairperson for today, to kindly present the token of appreciation to Dr. Meenakshi. Thank you, ma'am. With this note, we head to the second resource person for the day, Dr. M. Kishore, Professor and Head Department of Psychiatry, Jesus Medical College and Hospital. He has more than a decade of experience in medical undergraduate and postgraduate teaching learning. He has been awarded National Fellowship of the Dr. Ramachandran N. Murthy Foundation for Mental Health and Neurological Sciences. So you will be please seated. Awarded 11th International Neuropsychiatry Association T.S. Srinivasan Award 2018 for his initiative to enhance quality of neuropsychiatry education training in India. He initiated Medical College Psychiatry Teachers Forum in India and involved in Infosys Foundation funding for enrichment training in education and research, a first of its kind globally. He is trained at NTTC JIPMER, Pondicherry in medical education. He is National Chairperson of Faculty Training Task Force at IPS since 2020. Invited guest faculty at AMSIT University, Malaysia, and Jesus Aher University delegate to the Mayo Clinic. Editor and founder member, India's first monthly newsletter, Minds, for doctors, and has been an editor for 6 books. Sir has published papers both nationally and internationally and is currently involved in ICMR DST, DBT funded research on cognition. Dr. Kishore would be today talking on the work-life balance skills. Let's hear from him. Over to you, sir.
Seeking the blessings of His Holiness, it's indeed a privilege to be in the platform. Respected chairpersons, respected seniors in the auditorium, my dear friends. This is a very challenging topic, and I'm not sure how much we can bring the skill within few minutes. But I'll try to take you through the journey of how this will be beneficial to you. So I was keen to know who will be my audience, and Dr. Madhu, who coordinated, she said there will be some boys and men. So don't focus everything on girls. So I see that there are many men and boys sitting there, and I'll try to tailor the issues on this context. So how many of you know Kannada? Raise your hands. Oh, ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ ಬರುತ್ತೆ. ನಾನು ಕನ್ನಡದಲ್ಲೇ ಎಲ್ಲ ಮಾಡ್ಬಿಡ್ಬೋದು. Good. So the first thought which comes to my mind is about gratitude. In whom should I be thankful? To His Holiness, who thought about this institution, to the leadership who thought about this components of the university, or to the organizers who made this. And very interestingly, in the recent time, COVID-19. In the middle of COVID-19, all of us saw, we lost our family members, we lost our colleagues, we lost some of the people who were close to us. How many of you lost a family member or a friend or a colleague? COVID-19 ali? Sambandhikru? At least 20%. I remember Vijaya ma'am writing so beautifully about what she experienced during the COVID-19. And I want to start with this statement. We should be in gratitude, both in life and work, for what we are. ಏನ್ ಅದೃಷ್ಟ ಅಲ್ವಾ ನೀವೆಲ್ಲ ಮಾಡಿರೋದು. ಸಾಕಷ್ಟು ಜನಕ್ಕೆ ಪೇರೆಂಟ್ಸ್ಗೆ ದುಡ್ಡೇ ಇಲ್ದಂಗ ಆಗೋಯ್ತು. ಅಡ್ಮಿಷನ್ ಫೀಸ್ ಇಲ್ಲ. ನಿಮ್ ಪೇರೆಂಟ್ಸ್ ಎಲ್ಲ ನಿಮ್ ಬಗ್ಗೆ ಯೋಚನೆ ಮಾಡಿ ನಿಮ್ಗೆ ಕಾಲೇಜಿಗೆ ಕಳ್ಸಿಕೊಟ್ಟಿದ್ದಾರೆ. ಐ ನೋ ವೆನ್ ಪೀಪಲ್ ಕಮ್ ಟು ದ OPD, they struggle saying that 2 ವರ್ಷ ಏನು ಇನ್ಕಮ್ ಇಲ್ಲ, ಹೆಂಗೆ ನಾನು ಫೀಸ್ ಕೊಡೋದು ಅಂತ. ನೀವೆಲ್ಲ ಎಷ್ಟು ಲಕ್ಕಿ. ಎಷ್ಟು ಜನ ಮೈಸೂರವರು? So many. Okay. So I believe that gratitude is the index of work-life balance. And very importantly, I wanted to make it as interesting as possible, and I'll try my best. So the first question which comes is balancing life. What is it? Balance andre ಏನು? ಏನ್ ಮಾಡ್ತೀರಾ? Second, how to do it? Suppose ನಾವು ಮಾಡ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಏನಾಗುತ್ತೆ? These are the 3 questions to the audience. Mike ಸ್ವಲ್ಪ ಕೊಡ್ತೀರಾ? ಯಾರು ಇದ್ದಾರಾ? Anybody? What is this balancing? Boys and girls? No, because it's women's workshop, only ladies. Girls and ladies, please. Somebody? Anybody? Yeah. Quickly, because I want to make this crisp. Divya, madam.
Hello, sir. Balancing life in such, since your topic is on work-life balance, how much I work, spend my time at workplace versus how much of time and dedication am I to my family is the balance.
Balance.
If I work 9 to 4, I keep dedicated to the work, go back home, stop working for the profession and get back to my family is how I balance.
What happens to you if you don't do it?
If I don't do it, the first part which comes is the guilt.
Guilt. Okay.
I'm not doing a professional justice at workplace versus I'm not doing a professional justice as a parent, as a daughter, as siblings. So it's basically that sort of guilt which
Guilt.
comes. Yeah.
Excellent. To the girls there, yeah. Yenagate. Nimge yenagate. Work-life balance. For you, study and other aspects of life. Balance madlilla andre yenagate. Kudi mic kudi avaru iskolalla kudi. Yeah, please quickly. Somebody. ಈ ಕಡೆ they're all shy. ಮೈಸೂರು ಅವರೆಲ್ಲ ಇಷ್ಟೊಂದು ನಾಚ್ಕೊಳ್ತಾರ? Yeah, please give it here. Madam, Katyani madam, Moli, give it to her. I want to listen from her. ನೀವೇನ್ ಮಾಡ್ತೀರಾ? How do you balance?
ಸೇಮ್ ಮೇಡಮ್ ಹೇಳ್ದಂಗೆನೆ ಫ್ಯಾಮಿಲಿ ಲೈಫ್ ವರ್ಕ್ ಲೈಫ್ ಎರಡನ್ನೂ ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡ್ಲೇಬೇಕು, ಅದರ್ವೈಸ್ ಸ್ಟ್ರೆಸ್ಗೆ ಒಳಗಾಗ್ತೀವಿ.
ಏನಾಗುತ್ತೆ ಮೇಡಮ್ ಸ್ಟ್ರೆಸ್ ಆದಾಗ ನಿಮ್ಗೆ?
ನಾವ್ ಎರಡೂ ಕಡೆನೂ ಕರೆಕ್ಟ್ ಆಗಿ ನಮ್ ಡ್ಯೂಟಿ ಮಾಡಕ್ಕಾಗಲ್ಲ, ಪರ್ಫಾರ್ಮ್ ಮಾಡಕ್ಕಾಗಲ್ಲ.
ಅವಾಗ ಏನಾಗುತ್ತೆ? ಅವ್ರ ಗಿಲ್ಟ್ ಅಂದ್ರು, ನಿಮ್ಗೆ ಏನಾಗುತ್ತೆ ಮಾಡ್ಲಿಲ್ಲ ಅಂದ್ರೆ?
ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ.
ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ. ಫೈನ್, ವೆರಿ ಗುಡ್. ವಿಜಯ ಮ್ಯಾಮ್, ಲಾಸ್ಟ್ ಸಿಟ್ ಬಾಲ್ಕನಿ. ಯಾ after that.
Not be happy, Kishore.
Not be
If
happy.
I can't balance, I won't be happy.
Correct. Madam will ask, there is a lady who wants to, yeah, please. Very interactive crowd. Last bench or eno madala anta ನಾವು ಕ್ಲಾಸ್ ಅಲ್ಲಿ ಹೇಳ್ತೀವಿ. She is from that end, she wants to talk.
So as ma'am said, one more thing I want to tell that like I need to give time for myself.
Correct.
That is also
Very nice.
important.
Very nice. Yeah. But what happens to you if you don't do it?
Again, stress that
What?
I'll not be able to concentrate on other things.
You can't concentrate. Excellent. Somebody feels guilty, somebody feels not happy, somebody feels pain, somebody feels that they are not doing justice. These are many facets of a thing. The whole question is about how do we enjoy life and balance everything. Is that what all of you want? Very nice. Okay. So people have seriously explored what makes people balance. What is it? What is it? What you should have? Targets. What is that target and goals? IQS ಇವ್ರನ್ನ ಕೂರಿಸ್ಬಿಟ್ಟಿದ್ದಾರೆ, ಅವ್ರಿಗೆ ಟಾರ್ಗೆಟ್ ಕೊಡಬಾರ್ದು. You should never involve. But what is your personal? What is that you want to do? What is that you want to do in the course? What is that you would want to do in the things? And one of the most challenging tasks is prioritization. Now, what is my priority? Now, what is my thing? It is such a difficult thing to just learn prioritization. How many of you are okay with prioritization? Priority, idadmele idu anta. How many? A good number of them. Excellent. It's very difficult skill and it takes many years to achieve prioritization in thing. The next thing people have found out is, this everybody understand, happy. When in extreme difficulty also, in extreme things also, smile. I was telling the story of Angulimala. If Angulimala had not been there, Buddha wouldn't have emerged. Angulimala abused Buddha, threatened Buddha, wanted to kill Buddha. But Gautama Buddha was smiling, just subtle smile. And this man who was wearing the fingerings of all the people whom he killed, wanted to show the fear, could not. Buddha was calmly smiling and Angulimala was taken off. At that time, he surrendered himself. Mere smile. There is not even a one word in record. What did Gautama Buddha said? He just smiled. And that created fear in a person who wanted to induce fear. Obviously, this is one of the important tasks of being happy. But people have started to live. Who is very happy? And they found only two jobs. One of a teacher, another a gardener. ಇಲ್ಲ ಗಿಡ ಬೆಳೆಸೋರು ಇರ್ಬೇಕು, ಇಲ್ಲ ಕಾಲೇಜಲ್ಲಿ ಸ್ಕೂಲಲ್ಲಿ ಟೀಚರ್ ಆಗಿರ್ಬೇಕು. ಅವರಿಬ್ರೇ ಸಂತೋಷವಾಗಿರೋದು. How many are you from teaching profession? Raise your hands. Very good. How many are interested in gardening? Raise your hands. Excellent, excellent. ಎಲ್ಲ ಹುಡುಗರೆಲ್ಲ ಗಿಡಗಳು ಬೆಳೆಸ್ತಾ ಇದಾರೆ ಈಗ. ಬಹಳ ಚೇಂಜಸ್ ಆಗಿದೆ. Now, what is this? What is your opinion? Why is a gardener so happy? What might be the reason? Anybody? What is he doing? Why a gardener should be having the happiest job? Yargaru? Anybody would like to? Yeah, please give the mic to her. Madam, please tell me the time, or balancing will not happen.
That's because he's happy for the time he has put into the flowers and gardens, and if he sees them bloom, he feels rewarded for it. So he's very happy with it.
Excellent, excellent. There is so much of joy to allow a life to blossom, to nourish it, to see what happens, and most importantly, there is no verbal communication. And that brings lot of beautiful things in life, and people have looked at joy at workplace and they have found professional diversification. Irrespective of the position you hold, to balance, we have to have multiple things. I was really surprised by Meenakshi madam, how much time she has spent on this topic. All the time I was adjusting my back, I was adjusting my foot, where it is not right. So from a dental perspective, why did she invest so much? So this professional diversification, being in magazine committee, cultural committee, teaching, learning, everything which adds lot of joy at workplace. I was also happy when they called me here, because first, after giving me HOD of the department, I did not have breathing space. I ran away today and they said there will be a lot of girls and women sitting there. So it was such a big change for me. Joy at workplace comes from new avenues, and that is how we should try. Now the another people, another thing people have found for work-life balance is willingness to help others. How many of you think it balances? How many of you think? Excellent, excellent. I was seeing those people who took over head of the department, who left the department and all people who left as HOD of the department were very happy. Because too much of thing need not be done. But in the process, they have helped others to come up, to coordinate, to support. And we always tell the students in exams, exam time al matra bereyavrige help madak try madbidi anta. Avaga paper kododu, avaga answer sheet torsodu. You want to help, please help them in the other time. Not in the examination hall, where you all want to show your friendship. That is another way of helping these things. There is this concept called as childlike heart. Irrespective of which level you have grown up, especially adults. Anybody who has seen this childlike heart? Anybody? Any examples of any person? Abdul Kalam, Dalai Lama, my goodness, how much of childlike heart these people have. How many of you know that Dr. APJ Abdul Kalam was associated with JSS University? So many. You may not be lucky, but there are videos available. He was there all the time happy. And I believe you know this story. He came to Sharda Vilas College and people were waiting on the stage. For half an hour, he did not come to the stage. They were all perplexed. Where is this president gone? He was at the entry listening to Nadaswara. Half an hour he was listening to Nadaswara because these people, Nadaswara is Shehnai. They were playing Shehnai and this man was perplexed. He forgot where he is, what he wants to do, and this childlike heart is something you should never grow up. Balancing work life is that don't make anything seriously and never grow up. That's a very bad thing for balancing issue. Now, is there evidence for avenues to well-balanced life? What can you make out of this? Anybody? Image? Everybody can say it. What you can make out? What is happening here? Huh? Yes, boys and girls, please. Ladies, anybody? Nourishment, yes. ಏನ್ ಕಾಣಿಸ್ತಾ ಇದೆ? ಟೀಮ್, ಓಕೆ. ಕ್ಲೀನ್ಸಿಂಗ್, ವೆರಿ ನೈಸ್. ಎಲ್ಲ ಕಡೆ ಮಾಡ್ಬಿಡ್ತಾರೆ, ಕ್ಲೀನ್ ಮಾಡ್ಬಿಡ್ತಾ ಇದ್ದಾರೆ. ದೇ ಆರ್ ಥ್ರೋಯಿಂಗ್ ಸಮಥಿಂಗ್, ಪುಟಿಂಗ್ ಸಮಥಿಂಗ್. ವೇರ್ ದೇ ಆರ್ ಡೂಯಿಂಗ್ ಆಲ್ ದಿಸ್ ವರ್ಕ್? In the brain and the mind. As if you have given your vehicle for thorough wash. You have taken off your brain, poured everything. How many of you want to try this? Some of them, very nice, very nice. Future. Now, what do you mean by this is that they have found significant happiness and peace in balancing life comes from being in the middle of green. Everybody talks about randomized control trials. There is a beautiful randomized control trial by Kim Kesar. Simple thing. He removed consistently some objects from people's life. For some people, he did not remove. Like, for example, this week mobile is taken off from you. This week sofa is taken off from you and all. You know what happened? People who lost materialistic goal became happy. Surprise, it is randomized control trial. Anybody who is in things, this is the thing which came in this beautiful thing. The more you spend in the nature, the less materialistic. There is perfect balance in the work and life. That's why we have a beautiful campus in university. I really love it. There's so many birds, there are so many butterfly. Hospital enu illa, illi matra ella ide. So that is another way of joy being in this campus. Now, very strange thing came in 2021 because there are future leaders sitting here and many people will become leaders. In BBC, Ireland became first country legal right to disconnect and protect work-life balance in May 2021. You can't post anything in WhatsApp or mail for anything related to work when you are in home. The country, Ireland, legalized it. How many of you like this? Raise your hands. Photo tagondiri sir. How many have said this? Yesterday I sent a WhatsApp message to the whole department. They are all up in the arms. At 6:30 you sent us message. So a new thing is that you should reduce your usage of mobile phones for work-life balance. How many of you think mobile usage has become a nuisance in work-life balance? Good number of them, good number of them. Those of who was using tell him also that it has become a nuisance and it is a new craze because everything is happening on phone, your travel, food, your communication, mails, everything. So if you really want to be happy, less tired, less lonely, less distress, reduce your mobile phone usage. So the international guidelines is not more than 90 minutes per day. or per working hours, whichever you want to think. So that how to say no, who should say no to the mobile? We should say no to the mobile. The worst thing in this last decade is enormous issues of mental health. The Prime Minister himself had to chair and he said, please do something. And they came up with a all over India helpline available in all languages for all people 24/7, which is Telemanas. Tamil, Telugu, Kannada, English, Hindi. It is continuity of services, therapy, treatment, everything by professionals linked to JIPMER, AIMS, NIMANS, all premier institutions. So strength is in taking help. How many of you think you should take help when there is a problem? Excellent, excellent. No matter which position you hold, only those people when they have trouble and take help, only then we can have a very safe and a very productive balance on this. Now, most difficult thing is forgiving others. Shamsodu bala dodudu, bala kashta. How many of you agree that forgiving is the most difficult? Everybody. Those who can forgive, remember, adu devar guna. It's never easy, never easy. I hope you remember Amarnath. How many of you go to Amarnath? Amarnath Yatra? Few. Okay. Anybody knows what do they call Shiva there? Bholenath. Have you heard Bholenath? No, I was puzzled. What do you mean by Bholenath? They told a story. How many of you want to listen to the story? Everybody. Okay. Quickly, this man was abusing Shiva all the time. And the people said, get him to the Lord Shiva. So they said, he has abused you, scolded you, what should we do? He said, go to the place, get a pallaki. Make the person sit on pallaki and get him to me. So people were perplexed. Have you gone crazy? See, this man abused you and you are pallakil karkon banni antidirala. He said, let him come. So they brought this man in Pallaki and showed him. This man just found it extremely difficult to accept the God whom he had scolded all his life. Then people said, that's why he is called Bholenath. God is forgiving. So forgiveness is the most important factor in balancing work and life, because there are too many people who curse us, who fight for us, who feel that we have done something wrong, and we feel that they have done wrong, and very difficult. I have also found it extremely difficult to follow forgiving others. Extremely difficult, but try. If you are lucky, and if you think that the godly characters have entered you, you will do it well. What is this? You should have very good friends. Very good friends. How many? What do you mean by good friends? How much should be the number? WhatsApp 254, huh? Facebook 500, Insta 2000, 1000 followers. You should have 3 or 4, but they should be really good friends. Very good friends. And they should tell you when you do wrong. You should. These are the friends. See, all the time this boy or girl says, "Neen madide sari andre." No. He's not there. They should tell you on your face, no, what you have done is wrong. They are real good friends. And it is never easy. Who has to put money in the bank? Customers or the bank? Customers should put the money first. So who has to invest in friendship? For work-life balance, we should have investment in friends. Whoever has invested will get the benefits. Just like bank, it will never mature so easily. 5 years, 10 years, 20 years. Okay. So this is the teamwork. All of you agree in thing, and it makes your job well. Does it help in work-life balance? Teamwork? Both at home and at this. It's teamwork. It's very challenging, but this is one task which has always been found to be difficult. And most importantly, family gathering time. Do you have family gathering times? Because everybody is using the phone and the other things and all. ತಿಂಡಿ ಕೂತ್ಕೊಳ್ಳಲ್ಲ, ಊಟಕ್ಕೆ ಜೊತೆಗಿರಲ್ಲ, ರಾತ್ರಿ ಊಟಕ್ಕೆ ನಾವು ಇರೋದಿಲ್ಲ. This is a new trend. Those people who don't have a family gathering time, it is difficult, and they have problem in the workplace also. So this is something we have all looked at, work-life balance, and they thought that hobbies are one hallmark of balancing. How many of you have hobbies and interest? Excellent, excellent. What kind of hobbies you have? Anybody? Watching movie, sleeping. The definition of hobby is that first, you should not generate money out of it. Second, it should be actively pursued for just the sake of doing it. So, in professional life and personal life, everybody should have some or other hobby, which is unique for them. We have our book club. Me and Vijay ma'am were part, and everybody. We started a couple of years ago. This is one of hobbies, but you can have many, and they have found in Mayo Clinic proceeding by our professor in medicine, Dr. Kiran, anybody who reads novel is more intelligent than a person who does not read. I think impact factor is somewhere 10 for this publication. They took PGs, half of them read Sherlock Holmes. Sherlock Holmes kelidira? Half of them know Sherlock Holmes. And they saw who is good in looking at patient, diagnosing and all. Yaar Sherlock Holmes odidro? Our smart idro. Those who did not read Sherlock Holmes did not have the required skill. Very surprising, no? Hobby and the LTV, but it shows excellent evidence from the thing. What is this? All the time playing, enjoying, and then suddenly struggling to work. So this working from time to time is a hallmark of balancing. How do we work at home, at place? More often, it helps us to define on these parameters. And this is a very simple video. I'm not going to flow. But whenever you are stressed, there are 3 things which I have found to be enormously useful. First is breathing very slowly. Second, humming a song. They have not said which song, but hum a song. Third thing is about focus on one issue. Very nice. If you go to this BBC, I forgot, I think it's some link I'll forward, but this is one of the most interesting data on balancing life for keeping us calm. Now, many people assume taking alcohol or smoking is a way to cope up personal and professional life. How many of you have seen these people balancing their issues at work and home by alcohol and tobacco? So many people try smoking cigarette or taking alcohol to balance. One of the worst thing is about what happens to these people, because much of the mess happens for boys and men. Smoking is always associated with sexual problems. Do you know? Cigarette smoking, pan parag, hans. These are all things which have a serious issue on sexual problem. Nobody talks, but you open up any TV channel after 10:30 or 11, it's all about sexual problems. Smoking now is, there's so much of popularity of taking a cigarette to show off. And for girls also, this is a new trend. In all movies, they want the girls to try. We never thought that people, girls and women from Mysore and surrounding areas would come with so much of problem. It's now a trend to take alcohol and smoking because it's a cool stuff as shown by the movie. The heroine does it, Every character does it. So the girls and women feel that why not? They never look at, unlike men, women seem to develop liver and lung problems very fast, very fast. And they say this is only breezer, this is the, just what do you call, beer. Beer which was 4%, the strong beer is now 12% of alcohol. People don't even know how they have changed the percentage of alcohol for you to try it, get hooked. So women have serious issue. And the last is about being realistic. Do you think that being realistic will help work-life balance? Everybody. Being flexible, does it balance life? And having a planned break. How many of you have planned break? Few. Sudhindra sir can't do it. Exam time. Madam is there. So if many people in leadership are doing it, we should also do it. Tomorrow leave, madam, I am taking 2 days. So planned break and let go of things cannot be controlled. I remember Vijaya madam's article, how she accepted COVID. I think it should be circulated. You should see the narrative. People who suffered in isolation in the wards, how they accepted. Just to let go of things which cannot be controlled is a progress towards balancing life. So with this, I'm extremely happy for giving some time, and I hope rest of the things can be discussed. Thank you so much. If there are any questions, I'm here. Thanks.
Thank you, Dr. Kishore, for this interesting and interactive session, isn't it? Yes? No? Yes? How many of you agree that he practices what he preaches? He had a smile throughout his presentation. Yes? Yes. That's a good audience interaction too. So indeed, sir has aptly guided us on maintaining the work-life balance, which is a crucial aspect for every woman in the present day. I may be biased if I don't include men. I'm sure even they also need to, work-life balance is also an integral part for them too. So with this, I request the chairperson to reflect on the presentation. And if there's any queries from the audience, request the UT team also to participate. Any queries from the audience, please?
Thank you very much, Kishore sir, for bringing this very important issue. The work-life balance is something which is debated over years. So initial days, we struggle to build our career in work. And by the time it settles, we struggle in life to settle the life. And by the time the struggle gets over, either work is over or life is over. So we are in that particular situation of mind. So balancing the work and life is very, very important. And, always we as professionals, we also get the complaints that you are not balancing well. Okay, so at that point in time, we definitely follow his order. Let some things go as they are. So this topic, I think it was really motivational, well articulated, well structured, and he has touched upon very important aspects which are very simple and very realistic, like to be smiling all the time and prioritizing the work, joy at the workplace, then willing to help others, childlike heart, forgiving others, and working in the team. Have good friends. These are all something which are not very, you need not have supernatural skills to do all these things, which are easily done. But for that, we need to have a heart which is accepting, flexible, and which is more going to get connected to the people. Okay, thank you very much, Dr. Kishore, for this wonderful session. And I think people are going to take it further. We can easily connect Dr. Meenakshi's talk with Dr. Kishore's talk. She was talking about ergonomics. Let me tell you, as a public health professional, ergonomics is not only to do with machines; it is to do with mind also. Okay, we in workplace there are 3 things that we need to concentrate on: machine, mind, and machine, mind, and workplace. Okay, so all these things should be kept into consideration. And I think she spoke about machine, he spoke about mind, and we need to balance the balance between both of them to have a more fruitful professional life. Thank you very much. Sorry I took long time, but I thought I'll put all the things in place.
Thank you so much, sir. Thank you so much. Sir, may I request you to kindly present the token of appreciation to sir? You have to balance on. Thank you, sir. Dr. Praveen, sir has requested to leave due to some emergency. So I request Dr. Katyani to kindly present the token of appreciation to sir.
We have a national conference going on in the department. I did not want to miss this event because I wanted to listen to both of them. And thank you very much. I wish the next speaker all the best. Thank you so much.
Thank you so much. May I request Dr. Mahalakshmi to kindly introduce the next resource person for the session?
Good afternoon, one and all. Indeed, I'm highly privileged to introduce the next speaker for the day, Dr. R. Surendra Bhatt. Sir is Professor of Pharmaceutics at JSS College of Pharmacy, Mysore. Sir has over 25 years of teaching and research experience. His areas of interest include management sciences, industrial management, quality assurance, regulatory affairs, and designing and developing and testing of polymeric drug delivery systems. Sir has several publications and presentations to his credit, has developed good license with the various pharmaceutical industries in the country, and has undergone hands-on training on different aspects of the pharmaceutical industry. Sir has delivered personality development and soft skill development lectures on topics like communication skills, memory techniques, interpersonal relationships, body language, etc. Sir has participated in various faculty development programs, workshops, and conferences too. Currently, Sir is heading the Good Office of Examinations at JSS Academy of Higher Education and Research as Controller of Examinations. With this brief introduction, I welcome Sir to deliver the talk on communication skills, a tool for success. Would be delighted to hear from you, Sir. Please.
Thank you, Madam, for your kind introduction. Good evening to my esteemed colleagues and also dear student friends. I'm glad to be part of this particular program. And today in my presentation, I'll be just briefing few things which you already know. You had very good sessions now. One is on the work-life balance. The other one is on the ergonomics. And one which I am going to just brief you is the things that already you know. I'm just trying to summarize these things. The topic is communication skills. We talk so many things about communication skill. We should develop very good communication skill. We should be strong in communication and all those things. First question for all of you. When we say communication, what are the two ways by which we make communications? Two ways by which we make communications. Okay. One is that it is oral communication. Another way is written communication. Two things by which we normally try to communicate. One is by oral communication. The other one is by written communication. Okay, fine. Let me go to the. So what is communication? Let us try to define the communication. It is exchange of information or exchange of ideas. This is what we call as communication. Ultimately, when I try to give some information, you should understand that information. Then only it is called as communication. So communication is something where we try to exchange the information, convey the ideas, or exchange any other such type of ideas with one another. It is called as communication. What are the different types of communication? One is intrapersonal communication. What is intrapersonal? Talking to yourself. Many times we find difficult ourselves to understand our own thoughts. We say, I got confused today. I don't know what to do. Why this happens? Because I am not able to communicate clearly with myself. This is intrapersonal. How do you overcome this problem of intrapersonal communication problem? How do you overcome this? Maybe we say, sir has given some techniques, slow breathing, reduce your stress, do some yoga, do some meditation. All this will help to reduce your stress level and help you to develop a good intrapersonal communication. What is interpersonal? When you try to exchange the information with another person, it is called as interpersonal. This is what is the major thing that happens in our life. We try to speak with other person, and this is what is interpersonal communication. The next one is mass communication. What is mass communication? Somebody is a news anchor. He is doing a mass communication. We recognize so many people. He is a very good news anchor, we say, because the skill that is required there is something different than what you use for interpersonal communication. The type of skills that are required for different levels of communications are different. Large group communication, something like this, or a small group communication. At different types of communication, you should use different types of skills. You have heard a politician speaking. how the voice he will use to make the people to understand what he wants to convey. That is a mass communication, large group communication, small group communication, interpersonal communication. So the way in which you handle different types of communication, you should develop a very good communication skill. Now, when we talk about interpersonal, I'll be focusing more on interpersonal communication. What are the different elements that come in interpersonal communication? One is sender. Now, now I am the sender. I am trying to send you the message. Next one is the message itself. What is the way that I am conveying message? That is the second component. Third one is you are the receiver. You are the receiver. And the fourth one is the feedback. These are the four important components of communication. Sender, see, few things we should remember. As a sender, I should try to concise the information and try to send it to you. I should code it and try to send it to you. If I make a communication which is very, very long, then you feel it may not be received by the receiver properly. So first thing is you should be a good sender of the communication. And second one, you should also be a good receiver. That means when the other person speaks, you should try to take all the information that is coming from that person. And the message can be anything. See, even I say a body language can also be a message. For example, you say like this. That is also a message. That is also a message. And various means by which we can say the message. And the last one is feedback. See, feedback in communication is very, very important. That's why in the classroom also, when teacher looks at you, what you do normally, you will start doing like this. Even though you don't listen, but sometimes you will do that just to show that I am trying to give some feedback here, right? And feedback is very important in any communication. Maybe you are speaking with your friend on telephone. From other side, if no voice is coming, what do? You think that that fellow is not at all listening, right? At least, hello, 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 you will say in between. You say, yeah, tell man, you continue, they will tell from other side. Because if somebody gets bored, they will stop giving even feedback also. Because they get bored, sometimes the lectures, the classes we sit, after 30, 45 minutes, you will be completely blank like this. Even lecturer is seeing you also, you will not be doing any reaction because you forget to give feedback because you are completely bored with. See, feedback is very important. Even you have seen in the house, grandfather will be telling a story to the child. There was a king and he had 3 daughters. How many daughters he had? Why he will ask that question? That is to take feedback whether the communication is reaching him or not. See, taking feedback in communication is very, very important. Now, I am sender, you are receiver. Sometimes you become sender, I become receiver. It cannot be only one way in communication. It happens sometimes with our friends. There are some friends who always will be only senders. They will not be receiving anything. You will try to run away from those people, correct? Because they will never listen to you. They will only be talking whatever they want to tell. They will be continuously talking to you. So you should always change the roles. You should sometimes become sender, sometimes become receiver. But between the sender and receiver, there are many barriers will be there. This will not allow the message to properly flow. What are these barriers? Too much of noise. Too much of noise. You are in a jatra and some telephone call comes to you. You will not be able to communicate properly. There is too much of noise. Or some mobile ringtone is coming. And in the house also many times it happens, when telephone comes, the TV volume will be very high. Reduce the volume and all that you will be telling. Because you feel that the communication is not properly happening. Then unclear message. Somebody talks like that also. You will not be able to understand what he has told. Sometimes we simply say, oh yeah, fine. We don't understand anything because the message is not at all clear there. And lack of privacy is also sometimes problem. Many times you go and try to speak something, but you see many people are there, they will come back. Okay, the place is not good here, there is lack of privacy. Okay, many students may be having this particular problem speaking with another person because lack of privacy. And shyness also is a problem. Sometimes you want to tell something, but you will come back. You will come back because there is some sort of shyness. hesitation, multiple messages, and laughing when somebody, they will tell the jokes. Okay. More than the joke, they will be laughing and telling you don't understand anything. What is a joke? That also happens. Some people will cry and talk. You don't understand what they are talking. So these are all some barriers that comes in the communication problem. Okay. Now quickly I'll go to a few points. You will become sender in communication. You will also become receiver in communication. What are the important points that you should check there? As a sender, you should know to whom you are speaking. That is very important. You cannot speak in the same language with everyone. See, to a small kid, when you are talking, how do you talk? Hi, baby. How are you? When did you come? This is the way. You can't talk this to your principal. Hi, principal. How are you? Because you should know whom you are talking. Your way of talking to your brother or sister is different. The way you talk to your teacher is different. Your father is different. Your mother is different. The closeness which you have associated with that people will change it. And this is very important. But I have seen some people, they talk in the same way with everybody. They will talk in the same way with everybody. That should not be done. We have to look at it. And next one is, before you talk something, you should know why I am communicating. You yourself will not be knowing why I am communicating. Simply you will go and talk something, then you think, I don't know why I spoke all these things. So why you are communicating, and decide what you want to communicate. I am telling this because if you are going for meeting some important person, practice yourself what I should speak there. What are the things that I should speak to him? This is very important. You can stand in front of a mirror, practice yourself how I will be telling this message to him. What are the way that I should express this message to him? This is very important. What to communicate? When to communicate? It is morning is better, afternoon is better. Okay, principal's mood is better, father's mood is better, mother's mood is better, which time is better. So all these things you will have to assess before talking some important things, not routine things, some important things you want to talk. You will have to see when I should speak, how I should speak. That is, use the language the receiver understands. Use the language that receiver understands. And finally, where to speak. Now, you will become receiver also. When you become receiver, you should be fully attentive to the sender. You should be fully attentive. In the classroom, we say, you should be fully attentive. Why we say this? Because we have found that if you are listening properly in the class, about 50% of the things straight away go to your brain. You don't have to remember. 50% straight away go to your brain. But if you are not attentive, that 50% will not go. That's the reason. And next one is listen actively and ask for clarification. If you are not understanding something, ask for clarification. So ABC rule is be accurate, be brief, and be clear. ABC rule of communication is accurate, brief, and clear. What about message? The message which goes. There are 6 C's which you should see here. One is your message should be very clear. It should be complete. The message which you are talking or telling or writing should be complete. It should be courteous. It should be polite. You should speak in a polite manner with everyone. That is what is important in communication. It should be concise. It should be concise and it should be correct. It should be believable. And last one is, that's the same thing which I have told, is convincing. Now, fine, I am sender, you are receiver. But as a sender, to make the receiver to take the things properly, I should follow a few rules. One is, I should use simple and clear words. That is number one. Make your communication short and meaningful. Your communication should be a kiss. What is kiss? Keep it short and simple. So remember, your communication should be short and simple. And it should be non-confusing. The message which you give should be non-confusing. One important thing is when you are communicating, change the pitch of the tone. I have seen some people speak with the same. Today I am going to talk about communication skills. Communication skills, there are 5 types of communication. See, this will not be that effective. Then I change the pitch of the tone. It doesn't mean that you should shout with everybody, shout on everybody and start shouting everywhere you go. Not like that. you should change the pitch of the tone. That's very, very important. And add proper non-verbal communication. It is very important. That means when you're talking, you should make some acting also together. For example, hey, come, please come. Please be seated. So this is, I am trying to add the non-verbal communication with the verbal communication. This is very important. Do acting, but don't do overacting also. For example, if, hey, come. They may think something else if you are doing such type of overacting. Don't do overacting, do acting, and it should be matching type of non-verbal communication. I have seen some students in my class. Okay, they bring the practical. Hey, have you completed practical record? Yes, sir. Yes, sir. That means there is no balance between the verbal and non-verbal communication. If I see his head, it is saying no. He says in the mouth, yes. Probably he has not written, but he is trying to tell that yes, but his body language is saying no. Then assess the receiver mode. Take the feedback regularly when you are communicating and be a good listener. But okay, what about voice? Using your voice. Projection, speak louder. It should be heard to everyone. That's very important. Today I am going to talk about communication. There are three varieties of communication. Some people in the back, no, simply they'll be sitting and doing because they have been forced to come for the program. So they'll be simply doing that. That should not happen. You should speak louder and do not swallow your words. Tomorrow we'll all go to, you'll be thinking where? Because he has swallowed the word or he has reduced the volume. Okay. Vary the tone and pitch. Be confident. Pronunciation is very important. That is, you check the difficult words. Emphasize on few things. Tomorrow, all of you should come at 2 o'clock sharp. 2 o'clock. Okay. See, that I am trying to emphasize something so that you remember that. And repeat the key phrases and set the speed to the listener. See, listener's speed, small child, speed is different. Your friend, speed is different. With your boss, the speed is different. So you should adjust the speed also. Fine. Be an active listener. That's why we say God has given us 2 ears and only 1 mouth. That means double you should listen and half you should speak. We don't do that. In fact, many times we do the other one. We talk too much, we listen less. That should not happen. And if you are not ready to listen to anybody, nobody will listen to you. This is the fundamental of communication. You should be both sender and receiver. Okay, quickly I'll go to non-verbal communication. What are the codes of non-verbal communication? One is eye-to-eye contact with the person which you are speaking. Please, when you are talking to somebody, look at their eyes and speak. Don't look somewhere. Can we work tomorrow? We're back. See, we many times, body language, they say, if somebody is not looking at your eyes and speaking, don't believe that person. He has some other motive in his mind. That's why he's not looking at your eyes. That's why, when police interrogation happens, they will look at his eyes and speak. The eyes speak so many things. They can understand by the eye movement only, they can understand. That's why we say always we should look at the eye of a person and speak. Next is facial expression. Give a good facial expression when you are talking with somebody. Yeah, how are you? Very good, very nice. See, that is very important. You should always be smiling, even the work-life balance also. Means depending on the situation. Somebody comes and says, oh, my uncle died, sir. Oh, okay. Because facial expression is important, but appropriate facial expression is important. Next one is touch. Touch means it is not that I am advocating all of you to touch everybody and speak. No. Meaning is that when you are talking with your friend, okay, hi, how are you? See, this will add some sort of a good communication thing. And this is quite important that, you're giving a good handshake and speaking to patting his back or telling, hi, how are you? Well, these things are very important. And voice already I have told you, that is also very important. Posture and gesture, yes, important when you are talking. Eye contact is very important. What is orientation? Today we'll talk about communication skill. Body language, posture, orientation. Orientation is I am talking to you, I should be oriented towards you, not somewhere else and I am talking. Next is proximity. What is proximity? how close you are with the other person. See, in the body language chapter, there is something called as, there are distances which they give. Probably in the next slide, I'll be showing you. There are distances. Some distance, we think that is our personal distance. We don't allow somebody to enter into that distance. Normally, we find this when we are traveling the bus or train. Next passenger will be coming close to you. So you get irritated because he is coming to your place. You can just see that in your house only. You are eating something on the table, sitting, okay, dining table. They have brought and kept some item which you don't like. What do? You simply try to push on that side. You don't have to eat actually, but still you try to push it. They'll say, no, don't worry. Again, you will feel discomfort and you will push because you think this space belongs to me. Even on the chair, you have an armrest. Okay. To your armrest, somebody puts a hand like this. You feel irritated. Why this fellow is putting hand here? Why he is coming to my space? This is what psychologically we create our own zone around us. So this is quite important. This is what I said. Intimate distance, about 18 inches, we say intimate distance. Only few people we allow inside. Next is personal distance with the friends and all that you have personal distance. Next, social distance. A postman comes to your house. Do you go very close to him? Give the letter. No, you don't go. That you do with your friends. You go very close to your friend and talk. But a postman or a bill collector comes and you don't go so close to him. And public distance, we keep about 12 feet of distance when we do for public. Okay, what is the training we get for communication? For writing, they will give almost 10 years training to you. How to write, 4-line copybook, your handwriting is not good, it is like this, it is like that, it is sleeping. All that they will tell and they will give you training for about almost 10 years to, even after 10 years also we fail. We don't write properly. Okay. Reading, some 5 years they will give training for reading. Speaking, one year they will give training, you should speak like this and all that. Whereas listening, nobody gives training. But what is the one which you use maximum in your life? Listening is the one which we use maximum in your life. And writing, almost it is gone today. It has become, instead of writing, it has become typing. It has become typing. We just simply waste our time in typing. Okay. And another important thing, you see, our brain is amazing. It has a capacity, we say RAM, no? That is RAM in the computer. Similarly, our brain's capacity is that it can absorb about 400 to 600 words per minute. That is the capacity of our brain. It can take about 400 to 600 words. But how much an average person can speak? He can speak about 120 words per minute. That means there is a lot of gap between what our brain can take and what the words that can come. That means there is a lot of opportunity for the scope for the brain to take many other things. That's why your talk should be interesting so that all that 120 goes inside. Remaining things will not be absorbed by the brain. And like our calculators or our mobile phone and all that, after some period of time, like 10 minutes, our brain will go auto shut off. If nothing stimulus is given to the brain. So many lecture class, we find that you go there, sit there. After 10 minutes, you will be thinking something else. You will not be there in that particular classroom. That is because the brain. That's why there should be some masalas and spices in your talk. That's quite important. Okay, this already I have told you. I will not go to that. What is the problems in communication? Improper translation by the receiver. See, one of the major problem in the life is misunderstanding. Misunderstanding. That is because improper translation happens. You talk the same thing with everybody. Few people will take it in a different way. They take it in a different way and they misunderstand that particular thing. Imbalance between verbal and non-verbal. Voice is monotonous. No feedback coming. Disturbances. Lot of no eye-to-eye contact. These are all the problems in the communication. Okay. Peter Drucker, management guru, says 60% of the problems are because of the faulty communications. Communications are the major problem in the life. 90% of the serious controversies in the life are because of misunderstanding. It is only because of misunderstanding it happens. That's why we should have a proper communication with us. That's very important. Sometimes I was telling, even Dr. Kishore was mentioning so many things. Very nicely he has put so many points to tell that how you should balance work-life balance. Very, very important. Unfortunately, I could not attend Madam's lecture. Ergonomics is also a very important topic. In fact, one of the important thing is that we are all ill. That is a problem. What is ill? I lack listening. I lack learning. I lack liking. I lack loving. See, you should love everything that is around you. Then your life will be beautiful. There are 4 quadrants in the mathematics. You know, there are 4 quadrants in mathematics. One is plus plus. This side is plus minus. This side is minus minus. This is minus plus. There are 4 quadrants. Even in our life also, there will be 4 different kind of individual. I will not talk about this first quadrant. I will talk about the next quadrant. This is plus minus. Plus minus problem is these type of people think they are only good, all others are not good. Plus minus. This is called superiority complex. They always think whatever others do, they think that it is not at all good. Not good. What he does is only the good thing in his life. So this is the problem. Another quadrant you go. In this, he always thinks what he does is not good. All what others do is good. Her dress is very good. She is so good. That is good. But whatever your thing, not at all good. So this is a big problem. And when we give internal assessment marks in the classroom, before seeing your marks, what is your friend's marks? Because you are worried about your friend's performance there. So this is negative, positive, inferiority complex. This 4th quadrant is very dangerous, lifeless man. He always thinks what he does is also not good. What others do is also not good. Minus, minus. Always the thoughts are minus, minus. Always be in first quadrant. Always you think, I am also good, you are also good. I am also beautiful, you are also beautiful. What you do is also good, what I do is also good. Life is simple. Life is good. Life is happy. That's all we want in the life ultimately. What actually you have come to this world. You have come to enjoy your life and go. It is not just always try to say positive, negative, negative, positive. All these things are always be positive. That's all is the life funda. So we should be always in the first quadrant. That's quite important. Okay, I will not go to this because there is limited time, but this I just want to brief you and show you a few pictures on the perception. What is perception? What is perception? Perception is what is your thought on some communication that has come to you. Perceive that. How I perceive that. Same message is given to everybody, but everybody will not understand in the same way. Some people will think this fellow is thinking like that. Huh? Okay. Some people, so nicely he spoke. See, same thing, same message, different people will think in different way. I just want to show you some pictures. Tell me in this picture, what do you see? Yes. What do you see in this picture? That side. Some boys, what do you see there? Old lady. Picture is same. I have shown this picture to so many people. Some people see both old lady and a young girl also. Some people see only old lady. They say, sir, I am able to see only old lady, sir. No, where is the young girl, sir? Some say, sir, only young girl is seen, sir. Picture is same. Perception changes. Now, I hope all of you have seen both old lady and young girl. No. What you are saying, madam? Oh, you are saying only old lady? Oh, you are saying only young girl. Okay. You see this, take this as the eye, this as the nose, this as the mouth, this as the cheek. Okay, old lady, are you able to see now? Visualize. Visualize. How many of you have not seen the young girl in this picture? You have not seen? No, I am asking those who have not seen an young girl in this picture. Anybody is there? I want to just show that also. The picture By the way you look at, you can see both of them, a old lady and a young girl. Fine. How do you look at this picture? Some people will say it is half full. Some people will say it is half empty. Picture is same, but your mind, what it thinks. Some people, yeah, still half is there. Only half is there. See, both type of reactions will come for this particular picture. Please read this quickly. Madam, can you please read this? Fantastic. Read once again properly. Paris in the spring. 2 times they are there. We will not notice that. Many of us, we don't notice that. You ask any time, you will read the same thing. Okay, once in a lifetime. Now I say once in a lifetime. See, bird in the hand. But suddenly we ask, they will say this is the word. Fine. Are these lines which you are seeing here, these lines which I am showing here, are they parallel to one another or not? Are they parallel to one another or not? I am not talking about these lines. Not these lines. I am talking about these lines. Are they parallel or they are not parallel? I bet that they are parallel. They are parallel. They don't look parallel because of the crossed lines which are there. Otherwise, you take anywhere a scale and check. Exactly this will be parallel. They are parallel to each other. That's why we say you have good friends. Dr. Kishore was mentioned. Your friends will reflect your character. The lines, because of the lines, it doesn't look parallel. It doesn't look parallel, but they are actually parallel. They are actually parallel. What do you see in this picture? Girl's face. A man blowing a trumpet. Fine. Both can be seen in this picture. This is a beautiful picture. You can see so many things in this picture. So many faces you can see in this picture. See here there is a face. See here there is one face. See here there is one face. There is one face here. There is one girl here, an old man here. It looks like an old man. Right? Picture is so beautiful. It is so nicely created that it has got so many faces inside. Are these lines straight? You take scale and check. They are straight lines. Because of that circle, it looks they are slightly bent. They are not bent, they are straight lines. How many squares are there in this picture? How many squares are there in this picture? 1, 2, 3. There are no squares at all. They are all only zigzag lines which are there, but our brain thinks that there are squares which are present. Okay, what do you see? 2 wine glasses, 4 faces, 4 faces. This is height of creativity. See, so many animals are there in this particular picture. So beautifully it is done. You can see so many things in this picture. Fine. Count the black dots. But you see black dots, right? You see black dots, the moment you focus there, it will disappear. Brain is something which is beyond our own imagination. That is what I am trying to say. But you see somewhere here the black dots. Are you seeing that it is moving? Observe for some time. See the center block, it becomes darker after some time. I am not making any photo, this thing. Keep on observing that, it slowly starts becoming darker and darker inside. The center portion. Do you see a couple or a skull? Both are there. Okay, fine. Are these 2 lines are of, sorry. Yeah. Are these two lines are of same length? Yes, they are, but they don't look like that because of that the directions of those arrows. How many legs this elephant has got? Obviously, it should have 4 only, but it sometimes look like 8 also. Ask that person to stand on that side and say it looks, for him it looks like 3, for this person it looks like 4. The way it has been drawn, it looks like that. Which side is looking? Orientation, I was telling you. Both the orientations you can see in this picture. Front also, side also, picture is same, but the orientation seems different. Is something rotating? Optical illusions. They are optical illusions. Nothing is rotating actually. Our brain thinks that they are rotating. All these pictures I am just showing, these are all some pictures of illusion. It looks like they are rotating. In fact, they are all stationary, optical illusions. Wave, no, it is stationary. See this illusion. Looks like it's moving. Spot the hidden numbers in this image. Observe carefully. Some more you will get. There are so many. You carefully start observing, you will add one more digit to that. You will add one more digit to that. Means your observational skill should be very sharp in the communication. You should observe the things very. The moment we ask, they will immediately, sir, 528. 528, sir, 528, sure. But you add, there are some more digits behind, still one more digit on this side. So many digits are there. Which way the circle is turning? See, it looks like that. It has been put in such a way that it looks like this side, if you see it, looks like that rotation. Are the lines parallel? I'm talking about these lines, horizontal lines. They are parallel. They are parallel. Very carefully you observe, they are parallel. Circle or coil? Circle or coil? It is circle. It is not coil. You just focus on one and see it is just a circle. The arrangement of circles are such that it looks like it is a coil. You just go for one and check. If you see this, this is only a one circle, that's all. This is one circle. This is one circle. This is one circle. They are all circles. They are not coil. Lines, equal length, similar type of picture, but you see how short the one line looks there. But in fact, both the lines are of same length. What do you see in this? Good. Anything else? Yes. You will also see the way you think, you see that. Both are visible. Frog or a horse? Both. Picture is same. There are two different images, it looks like. Okay. Okay, this is one exercise for both of you, all of you. Are you able to see? In fact, there is no Photoshop or anything. You again focus that side and again you see it will start slowly. Now all the dots will disappear. We don't know how our brain thinks of all these things. It automatically makes things to appear something else that what actually is there. Some white background you should say. I don't see here any white background, but try. You should start blinking the eye. You are able to see whom? Deepika Padukone. You have to really experience this, this negative becomes positive in our brain and you will see a very clear picture. I don't see in this room a white background. If the white background is there, definitely you will see that particular thing. Yeah, that white, whatever that white portion is there in that slide only you can try to see and blink your eyes continuously. Then you will be able to see that. Okay. So this is very quickly to say you have A and B, right? Two blocks are there. Or the colors are same or they are different? A and B are different. Okay. I have not done any Photoshop here, but there is a scientific explanation given for this. When they are put in this particular way, both the colors become same. They have given some explanation. I don't want, there is no time for that, how it interferes and all those things. Finally, I'll be very quickly, few points about written communication, Shell. Very few points, be short and clear, have good ground in your basics, spelling, punctuation, grammar, have a spell checker, dictionary, grammar handbook, avoid making common spelling mistakes, identify commonly misspelled words by you and try to correct them. Okay, write properly. Many times write properly, we say. Just few slides I just want to show. We are trying to tell that go to other floor, but it looks something else. You are not written properly. Use the floor below. Instruction is to remove the cloth from the machine. Write properly, it will give some other meaning. Okay. Board outside a shop, somewhere the picture is taken. Shaving shop somewhere. Okay. Saloon. See, apostrophe has gone by mistake there. Not last one is not the incorrect board, it is a correct board only, but it was an interesting board, that's why I'll put it here. Okay. So spelling is not important because our brain is something different than a computer. Just I want to show. See the amazing power of our brain. If the first letter and the last letter are correctly kept, it will try to analyze which word it is. I think all of you have read this. See the spelling there. See the spelling. Totally there is no spelling at all. But you have completely read what is been written because that is the amazing power of human brain. One confidential report, boss writes to his student and gives him. Just read this report. Okay, so this is what he writes, the confidential report of that person, and he shows to that candidate. See, I've written a very good report for you. I'll put it in the cover and give it. You give it to your boss. Then he writes behind that. This is what he wanted to convey. So alternative lines should be taken. So finally, success can depend on being to communicate effectively. I thank Kokila Madam and her team for giving you an opportunity to interact with all of you. Thank you very much.
Indeed, a mind-boggling session, wasn't it? Yes, agree. All of you are smiling lots. We too are enjoying the session. Any queries from the audience and the UT team? If there are no questions, I request the chairpersons to kindly reflect on the presentation and provide the closing remarks for today's session.
Yeah. Good evening. Thank you, sir, for this wonderful talk on communication skills, where you started with the types and all the barriers, and you talked about the definitely a lack of listening, lack of liking, and liking or lack of loving is the major thing. Yes, communication is one of very, very important thing for the mental health of us also, as you all know. So I think I will be short, because sir has spoken extensively and he has told everything, and he has given the exercises for all our brains and how we perceive the things. So communication and perception, what other person says, we have to see it in all angles, just not in one angle. So what we want, we need not think in that same line. So look in the different angles and see what is the best thing, what is being communicated to us. So thank you, sir, for your.
Thank you, ma'am. May I now request Dr. Suma to kindly present the token of appreciation to sir. Thank you. I request Dr. Katyani from Department of Prosthodontics to present a token of gratitude to our chairpersons. Thank you, ma'am. With this, we move to the end of the session. I believe all of us have benefited from today's session. My sincere thanks to one and all who are present here and online, and the technical team, which has made this day a successful one. To help us understand the experience of our attendees on a deeper level and to improve ourselves in the process, feedback is the final component and one important factor in the process of communication. Request all to provide their feedback using the link today itself, if possible. Thank you. Have a nice